CBS News investigation underway for the past year and a half. We have really troubling new details about a new mom's death and our ongoing look at how private equity investors have siphoned hundreds of millions of dollars from community hospitals. In the state of Massachusetts, state officials and healthcare workers say that one company's efforts to squeeze out profits left their healthcare system reeling. Chief Medical Correspondent Dr. John LaPook is here with this story. It's a big one. John, good morning.
Good morning, Tony. 9 Massachusetts hospitals owned by Steward Healthcare are under intense scrutiny as the company faces a financial crisis. They include Boston's St. Elizabeth's Medical Center, where Sungida Rashid suffered complications after giving birth to her daughter last October.
Sungida Rashid's smile could light up a room. That's what her husband Nabil Huq told us from his parents' home in Bangladesh.
The laugh was, contagious, and you could hear it from a different apartment even. But that's something I really liked about.
With a baby girl on the way, Sungida, a statistics professor, and Nabil, a postdoc student at Boston University, chose to deliver at Boston's St. Elizabeth's Medical Center. The hospital is one of dozens across the U.S. acquired over the past 15 years, with backing from private equity investors, by a company called Steward Healthcare.
Do you remember Sungida's reaction when she first saw the baby?
She was crying. It was a beautiful moment, I wasn't expecting it to be this blissful.
That bliss was short-lived. Sungida experienced cascading complications, first bleeding from her uterus, then discomfort in a different part of her body.
She felt pain and she couldn't sit.
And would it be in like the back flank, like where the ribs are, kind of?
Exactly.
Doctors sent Sungida for an emergency CAT scan, then rushed her to the operating room.
And what did they find there?
That the liver was bleeding.
Doctors told Nabil they wanted to use what's called an embolization coil to stop the bleeding in Sungida's liver. He says when St. Elizabeth's didn't have the coil, she was transferred to a second hospital.
And then an hour later, she had another cardiac arrest and they couldn't revive her. It was shocking, I said, well, what exactly happened?
What exactly happened, including why she died, is now the subject of a state investigation. St. Elizabeth's own medical staff filed this complaint with the state's health department, saying the manufacturer repossessed the coil weeks before because Steward hadn't paid its bills. In a lawsuit, the manufacturer alleged Steward owed nearly $2.5 million.
It's outrageous. It's unacceptable.
Why outrage?
Because the supplies weren't available that could have saved her life.
Nurse Kathy Reardon is an official with the union that represents healthcare workers at Steward's 9 Massachusetts hospitals.
They bought these hospitals to serve the underserved, and that's not happening.
Last year, our CBS News investigation found a trail of unpaid bills at Steward hospitals around the country, leading to a shortage of potentially life-saving supplies. At this now shuttered San Antonio hospital, nurse Jessica Carrasco told us there was a shortage of tubing for respiratory masks.
Coordinators were having to phone a friend to let us borrow, a cup of sugar.
In December, Steward announced it was closing one of its Massachusetts hospitals, setting off statewide fears. In a statement, the company blamed its financial woes on the pandemic and lower reimbursement rates from Medicare and Medicaid patients.
Do you buy that explanation?
I think that's hogwash.
Massachusetts Governor Maura Healey says Steward executives have driven the company deep into debt and enriched themselves at the public's expense.
The game was come to Massachusetts, make some investments, and then begin to suck out as much as you can in terms of profits.
Steward's initial investments included propping up the employee pension fund. But financial records show that since 2016, the company has sold off more than $1 billion of its hospital's real estate. And in early 2021, Steward's owners paid themselves millions in dividends. Around the same time, Steward CEO Ralph De La Torre acquired this 190-foot yacht. Its price tag, an estimated $40 million. He declined an interview.
They've taken money away from these assets, which are so important, hospitals that provide needed care, and they're using that money to line their own pockets. I'm disgusted. It's selfish. It's greed.
Healey told us she's placed state monitors inside Steward's hospitals to try to ensure patient safety.
And we have to do that because Steward has failed.
It's just still surreal that she's not here.
Nabil, who first learned the coil was repossessed from a Boston Globe reporter, says he's trying to focus on the small milestones in his daughter's life instead of wondering whether Sungida would still be here if the couple didn't deliver at a Steward hospital.
Is that part of the problem? You'll never know. You'll never know whether having a coil would have saved her life or not.
Right. This is not how it should be.
In a statement to CBS News, Steward Healthcare said it's receiving a cash infusion that, among other things, will, quote, address vendor obligations. The company also said privacy law prevented it from commenting on Sungida's death and said its executives always put patients first. Governor Healy told us, quote, the sooner Steward is out of our state, the better.
Wow.
You're right, John.
Privacy
They will
laws.
never know, but the fact is that the coil, she would have had a better chance. We do know that, that's for sure.
Well, we don't know, and that's one of the things that's so tough for Nabil to live with. Would it have made a difference? Wouldn't have made a difference? There are a lot of things we don't know. The transparency here is not very good. There's an investigation.
The contrast of not paying your $2.5 million bill, so there's no coil there that could have saved this woman's life, and you
Yes.
having a yacht that costs $40 million if you're the executive. I bet they got life jackets on the yacht. They could afford that.
Well, once again, it's an issue. I mean, to my mind, we've done this investigation. We've done several of these stories of when health equity brushes up against private equity, guess what takes it on the chin? You know, the health
equity.
How much? Do you know offhand what that coil would have cost? Just one coil?
Yeah, I'm not quite sure. I think it's a couple of $1,000s or more, but I'm just giving you a guesstimate there.
A couple $1,000s for want of a woman's life. And then the child doesn't have a mom.
Patient's health over big business. That's for sure. Dr. John LeBouc, thank you so much.